This PowerPoint is going to be over Chapter 14, Radiology and Diagnostic Imaging, and it's going to start on page 514 if you would like to follow along in your book. So starting off, radiology, we need to know what it is, and it's the branch of medicine that uses radiation and other imaging techniques to diagnose and treat disease. Some things that you can see within this, you might have had these done before, you might already be familiar. We have X-ray, ultrasound, CT scans, MRIs, and nuclear imaging, or nuclear medicine imaging, and we're going to go over each one of these individually throughout this chapter. A radiologist is going to be the provider that specializes in the diagnosis and treatment of disease using radiation and other imaging techniques. And then X-rays, these are high energy electromagnetic waves that are invisible and have a short wavelength that enables them to penetrate solid materials in varying degrees. X-rays are used to visualize internal organs and structures which assist in detecting the presence of disease, so we can look internally at what the body looks like. Specifically, it's useful in detecting abnormalities within the skeletal system. So we're going to look at things like the bones, and it can help diagnose things like fractures, breaks within the skeletal system. Some radiographs require prep and some don't, and we'll get into which ones of those do and what kind of prep they do take. So we're going to start off within this talking about film-based radiography briefly, and then we'll get into some other different types. But radiographic film is going to be loaded into an X-ray cassette, which is a little device, and this is going to get placed behind the part that's being examined, and a shadow or image of the internal body structure photographed is produced on a film where we can see it. This film must be processed after, and then it's going to be taken to a radiologist where they're going to look at it, they're going to interpret the results, and then they're going to give a rundown. And then that radiologist is going to send that report to your provider that's taking care of you. Okay, next we have digital radiography. These are permanent images of internal body organs and structures that are obtained by passing X-rays through the body to act on a digital detector. This digital detector converts X-rays into electronic signals, which are sent to a computer to produce a digital image. A radiologist then reviews the images, and once again, it'll get sent to your provider. This is going to allow images to be taken and viewed immediately and allow them to be sent electronically. Some benefits within this: shorter radiation exposure time, so we're not going to be exposed to radiation as long. If you don't know, radiation can harm our body if we have too much of it. We do get better quality images, and then the ability to manipulate the images is going to be a little bit easier. And then we also have the ability to transfer electronically, so we can send it from hospital to hospital, doctor's office to doctor's office. Okay, next we're going to talk about contrast media. Contrast media is pretty interesting. It's a cool little thing that some of your radiology diagnostic imaging is going to have to include in it. So this is used to make a particular structure visible on the radiograph, especially when the natural densities of two adjacent structures are similar. So when two things in the body kind of look alike, it helps us dictate which is which. Typically, contrast media are radiopaque chemical compounds that cause a body structure to absorb more radiation, resulting in a contrast in the density between the body structure and surrounding area. So structures are going to become visible and they're going to turn more white on a radiograph. The contrast media is either going to be ingested or injected. So typically the patient is going to drink it, it's going to be an enema, or they're going to end up having an IV in their arm and they're going to inject that through the IV. So an example of this, barium sulfate, we'll talk about this in just a little bit actually. It might be, yeah, I think it's kind of one of our next things on one of the next few slides. But barium sulfate is a compound that they use to ingest orally. So they give you this nasty, chalky white substance called barium sulfate. They make you drink it, and then after a certain amount of time, they're going to do a CT scan or they're going to do some type of scan, and then it'll be able to highlight specific things within your GI tract. Another thing that they can do is with CT scans. You may have had one before if you ever gone to the ER and they have to look at your belly. If they give you an IV, they'll inject this stuff through your IV, and they'll tell you it's going to give you a warm, fuzzy feeling, and it'll make you feel like you've peed on yourself. And it truly does. It's the weirdest feeling in the whole world, but it also is going to help highlight specific structures so they can get a better view. So contrast media, the whole thing behind it, reason why we have it, it helps us see structures a little bit better that we might not normally see with just regular imaging. So some common compounds that we're going to use for contrast media. I mentioned one, barium sulfate, and then the other one are going to be iodine compounds. So with iodine compounds, I'm pretty sure the chapter is going to talk about this a little bit more. We have to make sure that they're not, obviously, that they're not allergic to iodine, but we also have to make sure that they're not allergic to things like fish, because fish can contain iodine. Okay, now we're going to talk about fluoroscopy a little bit here. Fluoroscopy, this is a procedure for viewing internal organs and structures directly in real time. Radiopaque contrast medium is often used to outline various parts of the body, and our radiologists can take radiographs that permit the study of structures in detail and serve as a permanent record. So when it talks about these being directly viewed in real time, it's not just like they're taking a picture and then that picture is being sent off. They can actually visibly see what's going on in that moment, kind of like a video versus a picture. Okay, positioning the patient. The position is going to depend on what type of scan it is, as well as what they're looking at, what specific body part they're going to be viewing. Jewelry and hairpins must be removed, that way that they're not obscuring the image. If it is more of like an emergency, sometimes those things don't matter quite as much, but normally they're going to tell you to remove anything like earrings, anything in your hair that's going to be metal. They'll have you remove your bra if it's got wire in it, necklaces, bracelets, those types of things. Patients do need to maintain the position that they're in and not move to prevent blurring of the images. So a lot of times you'll hear on scans, I know like CT scan machines, whenever it's getting ready to take a picture, it'll tell you inhale and take a deep breath, hold that breath, and then it'll tell you when to release. Some others don't have machines that are kind of like that. Like if you just have a normal x-ray, the radiology techs will be in there and they'll tell you, okay, I'm going to have you hold your breath really quick. That way they can get a still image and it's not going to be blurry. All right, so radiographic examinations. We're going to go through these and we're going to talk about mammography, bone density scans, gastrointestinal series, IVP, and then a couple of other smaller types. So we'll quickly kind of go through those. So the first one that we're going to start off with is mammography, and I encourage you to utilize your med term that you know to help you break down these words if you're not familiar with what these mean. So this right here, it's going to be viewing the breast. So mammography is a radiographic examination of the breast that's used to detect many forms of breast disease, like benign breast masses. If you don't know what benign means, it means good. So it means that it's not tumorous or it's not a tumor, it's not cancerous. We can also detect breast calcifications, fibrocystic breast disease, and breast cancer. It's also used to monitor the effects of surgery as well as radiation therapy on breast tumors to see how that surgery and that radiation therapy are, maybe to see if it's working, if it's reducing the tumor, if it's helping, if it's not. This does use low doses of x-rays. On this, an abnormal area is going to appear noticeably different from normal breast tissue. On page 515, that figure 14.4 is a picture of a mammogram, and the little arrows are going to show suspicious areas of increased density, so it's going to highlight a few different things. There's very little prep required, but this is important. We need to tell the patients that they can't wear any powder, lotion, or deodorants because these can interfere with the interpretation. These do contain specific chemical compounds that are going to interfere, so we need to tell them not to wear them. This does take about 20 minutes, so it's not very long. The patient is undressed from the waist up, and they're going to put on an upper body wrap. The patient's breasts do get flattened and compressed with a compression paddle. If you look on page 518, that next page, it does show the patient positioning. So the woman, she has no shirt on, no bra, nothing, and her breast is placed on the little tray type thing, and then it's getting flattened with the little paddle. They do take 2 radiographs of each breast as well. Next, we have a bone density scan. This is an enhanced form of X-ray technology that measures the bone mineral density of the human skeleton to see if there's any bone loss. When we age, as we become older, our bones become more dense, which results in them becoming weak and brittle and leads to fractures. I'm sorry, that's actually that specific part on that second piece. As we age, bones become more dense. That's not supposed to say more dense. That's supposed to say less dense. As we age, they become less dense, which results in them becoming weak and brittle and leads to fractures. Sorry about that. Factors that can lead to loss of density are osteoporosis, thyroid and parathyroid conditions, as well as medications. If you've never heard of osteoporosis, this is a condition in which gradual loss of calcium causes the bones to become thinner and a little bit more fragile. And this happens a lot as people age. Women are at more of a risk for this as well, especially postmenopausal women. This is the most widely used testing method, specifically the dual energy X-ray absorptiometry. The DEXA scan is what they call it, DXA scan. This uses X-rays to determine the amount of bone in the human skeleton. Patients undergoing medications for osteoporosis may undergo this procedure to see if their meds are being effective, to see if they're working. The patient should be instructed to abstain from taking calcium supplements or medication containing calcium for 24 hours before the scan. The patient is then going to be positioned on an X-ray table, and they must remain still. And the areas that are going to be scanned are their lower spine and then the head of the femur, so that top part of the femur that connects to their hip bone. Our next radiographic examination we're going to talk about is an upper GI series. We do have upper and lower that we're going to talk about. An examination of the upper digestive tract, GI series and upper GI series consists of an examination of the upper digestive tract using fluoroscopy and radiography. This can help us diagnose disorders of the esophagus, the stomach, and the duodenum. Duodenum is that first part of the small intestine. We have the duodenum, the jejunum, and the ileum, which are the 3 parts. But this specifically looks at that first part. So some of those different disorders that can affect those 3 parts include GERD, which is gastroesophageal reflux disease, hiatal hernias, ulcers, various inflammations, blockages, as well as tumors. This can be ordered when the patient complains of difficulty with swallowing, complaints of vomiting, abdominal pain, gastric reflux, severe indigestion, and blood in the stool. We do have some patient prep that goes along with this. So patient's stomach must be empty at the beginning of the procedure, and they must not eat anything after midnight and eat a light meal for dinner the night before. So nothing heavy the night before. At midnight, they should stop eating. When they get there, the patient's going to drink a suspension of barium mixed with water and flavoring. If we do a double contrast study, this is going to be a carbonated solution in barium suspension. The barium coats the GI tract and makes it visible on the screen, and then radiographs are taken. And then the MA should tell the patient that after this procedure, they might have whitish or light colored stools for 3 days, which is completely normal. Going back to the double contrast study, the reasoning for the carbonated solution, they might give a carbonated solution before the barium suspension, and this is because it's going to put air into their upper GI tract, which causes it to expand. That combination of air and barium together is known as that double contrast study, and it's going to allow the radiologist to view the esophagus, stomach, and duodenum in greater detail. They might not always do that, but if they want to look at it in greater detail, then they might. With this procedure, as the patient swallows the barium mixture, the radiologist is going to observe its passage down the esophagus and into the stomach and duodenum with the fluoroscopy. And that barium is going to coat the lining of that tract, which makes it visible on the screen of the fluoroscope. They'll take those radiographs and periodically during the exam to allow a detailed study of the upper GI tract and to provide a permanent record. They might change the patient's position at various times so that they can visualize different parts better and see different profiles. And then after the procedure, the radiologist is going to review it, they're going to prepare a report, and they're going to send it to the provider. And then the provider is going to contact the patient. So it's very important that we let the patient know, hey, this might take a little while, this is what's going to happen, and they'll contact you with results. Next, we have the lower GI series, or lower gastrointestinal radiography. This involves filling the colon with a barium sulfate mixture with a catheter inserted into the rectum through the anus. This is sometimes called a barium enema. This uses fluoroscopy and radiography to observe and obtain images of the colon, the sigmoid colon, and the rectum. It assists in diagnosing disorders of the lower GI tract, so some things like polyps, tumors, diverticulosis, and IBD, which is inflammatory bowel disease. This might be ordered when a patient is complaining of symptoms like chronic diarrhea, blood in the stool, constipation, IBS, unexplained weight loss, and changes in bowel habits. For this specific procedure, we do have to clean and remove gas and fecal material from the colon. So it's kind of like a colonoscopy where we have to kind of flush things out of the system a little bit. So the patient is going to be instructed to consume clear liquids only the day before the procedure. Then a laxative should be taken on the day before. They might also have to do an enema, and if you don't know what an enema is, it's an injection of fluid into the rectum to aid in elimination of feces from the colon. So essentially, it kind of looks like this bulb connected to a little tube, and that tube goes up inside the anus and rectum. The solution gets flushed inside, and then pretty soon after that, you'll be able to have a bowel movement, and it will be kind of liquidy, watery, but it helps clear out the colon. On page 519, towards the bottom of the page, it also says that the patient should not drink anything after midnight on the day before the exam. They can have water, however. And then on the morning of the examination, the patient might be required to perform a warm water cleansing enema until the returns are clear. The patient is going to relax on one side while a rectal catheter is inserted. Barium enters the colon and the provider takes radiographs, so it's very similar to the upper, it's just on the opposite end. During this, the patient will have a feeling of fullness and the urge to defecate. That just means they're going to have the urge to poop. The patient gets moved into various positions to allow the barium to enter the colon completely. They can get different profiles once again. If they do a double contrast, it's similar to that of an upper GI series. So they're going to insert air into the colon as well as barium. Once again, that air is just going to make it so they can view the colon in greater detail, makes things pop up a little bit easier, like polyps and small cancerous tumors. The MA should explain that whitish light-colored stool is normal for 1 to 2 days, just like with our upper GI series. Just because of that barium can make the stool look a little bit discolored. And then once again, the radiologist will do a report, they'll send it to the provider, and the provider will give the patient the results. Next, we have intravenous pyelography, which is sometimes referred to as IVP. This is going to be a radiograph of the kidneys, the ureters, and the bladder. This is used to assist in diagnosing kidney stones, kidney cysts, enlarged prostate, which occurs only in men, blockages, and tumors. The patient should consume only clear liquids on the day before the examination. The patient must take a laxative the day before to remove gas and fecal material. And the reason being is it's going to flush all of that out of the intestines, and it's going to help them visualize the urinary tract better. At midnight, the patient should not eat, drink, smoke, or chew gum. And then a contrast medium is going to be used unless the patient is allergic to iodine or shellfish, because they'll be using an iodine compound. And once again, shellfish can include iodine in there. So we need to make sure that we clarify their allergies. Even if it doesn't say it in their chart, we're going to double check and say, hey, what allergies do you have, and compare it with your chart, see if anything's new, those types of things. With this, it's very similar to the CT scan that I talked about a little bit earlier. I mentioned it when they put the iodine inside of oh goodness, I forgot the word for it. When they put it inside of the IV, it can give you that warm, flushed feeling. You might have metallic or salty taste, mild itching, might make you feel like you're going to pee on yourself. This can happen with IVP as well, but it only lasts for a little bit, and it's usually done by the time that the procedure, by the time that they get those radiographs and stuff. If the patient is allergic to iodine, they can use a different type of contrast medium as well. Some other types of radiographs, if you'll flip to page 520, if you're not there already, these are all on the bottom half of the page. So I'll read through these really quickly, highlight them, just know what they are. If you know some of the word parts from MedTerm, it can help out quite a bit. So the first one that we have is an angiocardiogram. This is a radiograph of the valves and blood vessels of the heart using a contrast medium and fluoroscopy to determine if there's a restriction in the blood flow going to the heart. A bronchogram is a radiograph of the lungs using a contrast medium to assist in the diagnosis of lung cancer, tuberculosis, and pneumonia. A cerebral angiogram is a radiograph of the major arteries of the brain using a contrast medium to detect blockages or other abnormalities in the blood vessels of the head and neck. A chest radiograph is a radiograph of the chest to assist in the diagnosing conditions affecting the chest, its contents, and nearby structures to detect conditions such as pneumonia, heart failure, and emphysema. A cholangiogram is a radiograph of the bile ducts after administration of a contrast medium to detect bile duct blockages. A coronary angiogram is a radiograph of the coronary arteries using a contrast medium to detect a restriction in blood flow to the heart. A cystogram is a radiograph of the urinary bladder using a contrast medium to assist in diagnosing problems of the urinary bladder. A hysterosalpingogram, and HSG is also called, is a radiograph of the uterus and fallopian tubes using a contrast medium to evaluate the shape of the uterus and determine if the fallopian tubes are patent, which means are they open, are they clear. A myelogram is a radiograph of the spinal canal using a contrast medium to detect conditions affecting the spinal cord and nerves within the spinal canal. And then lastly, we have a retrograde pyelogram. This is a radiograph of the kidneys and urinary tract using a contrast medium injected directly into the ureter through a ureteral catheter. The dye flows to the kidneys through the ureters to detect abnormalities of the urinary tract. Okay, now we'll be on page 521 talking about some other diagnostic imaging. So these allow for the visualization of internal body structures in great detail. So they're, once again, kind of the same thing as x-rays. They're looking inside the body in different ways. They can see different things. The most common that we have are ultrasounds, computed tomography, which is abbreviated with CT, MRI, which is magnetic resonance imaging, and then nuclear medicine imaging. These are usually performed in a hospital or a large clinic on an outpatient basis. I don't know if you'll ever really find them in smaller clinics. Ultrasound can sometimes be found in smaller clinics, especially like OBGYN, but especially CT, MRI, and nuclear medicine imaging, those are very specified, and a lot of times you'll see those at larger places or outpatient. First one that we're going to start off with is ultrasonography. This is the oldest of the diagnostic procedures, and it uses high-frequency sound waves for the study of soft tissue structures. This does not use any radiation. Some people get it confused and think that it does, but it does not use any radiation whatsoever. This is frequently used in diagnosing conditions of the abdomen and pelvic organs, so breast, gallbladder, liver, spleen, pancreas, kidneys, uterus, ovaries, and abdominal aorta. So a lot of people want to think of ultrasounds and they think of OBGYN, mom and baby, but it's used for a whole lot more. Some conditions that we can detect are breast cysts, gallstones, kidney stones, uterine polyps, abdominal aorta aneurysms. Pregnancy can be added in there as well. It's also used for guiding a needle during procedures. So sometimes they can do things called amniocentesis, which is done in a pregnant mom. I think we might learn about this a little bit in chapter 13, not 13. What chapter is it? Chapter 8, the gynecology chapter. You'll talk about that a little bit in that chapter. So they might use it in there. And then also IV ultrasounds. They can stick IVs on people that are really, really hard sticks. They'll use an IV ultrasound to find the vein and then poke it. Some advantages: it shows movement, it allows continuous viewing of a structure, it uses sound waves instead of radiation, and it's less expensive. So it's less harmful, less expensive. We can see things while they're moving continuously. Some limitations: we can't use it on the lungs, the stomach, or intestines. These are more hollow areas, and unfortunately, it just can't view those types of things. So it might be difficult to use with obese patients because of some of the extra tissue that it has to go through, especially since it uses sound waves. We do have to use a gel on the area that's going to be viewed, so whether that's on the skin or even they do vaginal ultrasounds, which is internally, so they'll put a little bit of like a gel lube type thing inside. They have like the little wand applicator. They'll put the gel and then they'll put like this thing that looks like a condom that goes over top of it, and then they'll put a lubricant that makes it go into the vagina easier. But gel has to be applied wherever it's being used. During the procedure, a probe is used on the skin and it moves over the areas to examine, so they'll continuously move it around so they can see. It's mostly used in OBGYN, obstetrics and gynecology, and it's used within here to confirm pregnancy, determine the size and position of babies in the womb, determine gender, as well as evaluating and treating infertility problems. So it's not just used in the OB aspect of things, it's also used in the gynecology world, which has nothing to do with babies. We do have a Doppler ultrasound. This is a special application of ultrasound. It measures directions and speeds of blood as it flows through blood vessels. So a lot of times they'll use Doppler ultrasound on like over top of pulse sites, especially in the feet. They'll see how well the blood flow is traveling down to the feet. And then if you'll turn to page 522, there are some patient guidelines. There are 3 right there. Look over those. I'm going to read them really quickly. So number 1, ultrasound is a safe and painless procedure that takes approximately 15 to 45 minutes to complete. Depends on what they're looking for, depends on the condition that they're trying to assess. Number 2, the patient may need to prepare for the procedure depending on the part of the body examined. An ultrasound of the gallbladder, liver, spleen, and pancreas necessitates that the patient fast for 8 to 12 hours. I have seen them do this without the patient fasting in the ED emergency room, but that's completely different. That's in emergency cases. This is important. For an OB ultrasound, the patient needs to have a full bladder, and that's because it can help push up the uterus and make it more visible. The patient should be instructed to consume approximately 32 ounces of fluid about 1 hour before the procedure. I will say, I don't believe the book talks about this, but sometimes with gynecology ultrasounds, not OB, with gynecology ultrasounds, they want your bladder to be completely empty, whereas OB, they want you to have a full bladder. And then number 3, the patient must remain still when requested during the procedure because movement can interfere with accurate results. In addition, the patient may be asked to change positions so that the organs can be seen at different angles. Computed tomography is our next type of diagnostic imaging. There are some guidelines to review on 523 that we'll take a look at after we go through this material here on this slide. So diagnostic imaging procedure, or this is a diagnostic imaging procedure that uses X-ray technology to produce detailed images of the inside of the body. It's primarily used to detect and evaluate tumors and abnormalities and to monitor the effects of surgery, radiation therapy, or chemo on tumors. It's well suited to quickly examine individuals who may have internal injuries and bleeding from automobile accidents or other types of trauma. It's used to detect tumors, lesions of the abdomen, locate injuries, tumors, clots that may lead to a stroke, brain hemorrhage, and other conditions. And it can reveal tumors, pulmonary embolism, excess fluid, emphysema, or pneumonia in the lungs. So this is used to view a whole lot. We can do CTs of the head, and we can do CTs of the abdomen. We can see a whole lot with a CT. This does require the use of contrast medium given by mouth, injected into a vein, or by an enema. Sometimes they will do CT scans without it, but if they don't have it, they can't quite see stuff as much. As far as the guidelines on page 523, there are 5 that go on page 523 through 524. So we'll look at these really quick. Number 1, if a contrast medium is to be used, the patient may need to fast for several hours before the procedure. It's important to ask the patient whether he or she is allergic to contrast media or to iodine to make sure there's no allergic reactions. Number 2, before the procedure, the patient must remove all radiopaque objects, so dentures, glasses, jewelry, because these can interfere with the clear image of the body part examined. Number 3, the technician will be in an adjacent room where the scanner controls are located. The patient is in constant sight of the technician, and speakers inside the scanner enable communication with the technician. And it just helps keep them away from radiation because they do this so many times on a daily basis. Number 4, the patient should lie motionless and breathe normally during the procedure. When the radiograph is being taken, the patient is usually asked to hold his or her breath to prevent blurring of the images. The patient hears slight buzzing, clicking, and whirring sounds from the scanner as pictures are taken. And number 5, the entire procedure, which includes setup, the scan itself, checking the images, and removing the IV, takes about 15 to 45 minutes depending on what part of the body is being scanned. Typically, if it's routine, it's just going to take about 15 minutes. Our next part here is magnetic resonance imaging, MRI. This is a diagnostic imaging procedure that uses a strong magnetic field, radio waves, and a computer to produce 3D cross-sectional images of internal body structures. It's low risk, and it once again does not require radiation. It's used for imaging tissues of high fat and water content. It assists in diagnosing intracranial and spinal lesions and cardiovascular and soft tissue abnormalities, such as herniated disc, torn ligaments, and joint diseases. So a lot of things with muscles and tissues. This is going to allow the examiner to see through bone and view fluid-filled soft tissue in great detail. With this, some patients might feel claustrophobic and need to have a sedative ordered prior to calm them down because these MRIs can take quite a while. We're going to go over the guidelines in just a second, and it'll show you the time that it usually takes. So if you'll turn to page 524, if you're not already there, we're going to review the guidelines on 524 through 525 really quick with MRI. So number 1, it's safe and painless, and it typically takes between 20 to 60 minutes, and that just really depends, once again, on what they're looking at, the size of it, and then how many images are being taken. But 60 minutes is a long time. Even 20 minutes can feel like a long time when you're in such a small spot. Number 2, a contrast medium can be used for the procedure. It does improve the resolution of the image by increasing the brightness in various parts of the body. Number 3, no special preparation is necessary for the MRI examination. The patient may eat or drink before the exam and take any prescribed medication. Number 4, because the procedure involves a strong magnet, the patient should remove any metal or magnetic sensitive items such as coins, cell phones, eyeglasses, hearing aids, dentures, watches, rings, and keys. Avoid wearing cosmetics and certain types of cosmetic preparations that contain small amounts of metal. Individuals with a pacemaker or cochlear implant may not be able to undergo MRI. That's something that they'll check with in their chart first, and then we can also usually see if the patient has those or not. And then number 5, the patient must remain completely still for 15 to 20-minute intervals during the procedure. The patient hears a metallic clicking sound that like a muffled drum beat during the procedure. Earplugs or headphones are available for use if the patient desires. That can help with some of that anxiety that comes with that claustrophobia feeling. Okay, and lastly here, we're going to talk about nuclear medicine imaging, which is going to include bone scans, nuclear cardiac stress test, and PET scans. So we'll finish up with these, and then that's the rest of the chapter. Nuclear medicine imaging is an advanced diagnostic procedure in which a tiny amount of radioactive material is introduced into the patient using IV ingestion, or inhalation, which is breathing in. Most radiopharmaceuticals are chemically bound to a complex known as a tracer. A tracer is designed to be attracted to specific areas of their body, or in some cases to types of diseased tissue. The patient is positioned on a scanning table that works in association with a specialized piece of equipment known as a gamma camera. This is positioned above or below the scanning table, and it is able to detect radiation being given off by the body part that has been targeted by radiation. It can help show functions of organs and provide more detailed information of certain conditions. And our most common procedures, like I mentioned earlier, are going to be bone scans and nuclear cardiac stress tests, and then we also have the PET scans. First, we're going to review a little bit about bone scans. So bone scans are performed to detect bone fractures that are difficult to locate. We can also look at osteomyelitis, arthritis, bone tumors, and metallic bone cancer. Or metastastic bone cancer. Patient is going to be intravenously injected with a radiopharmaceutical, so it's going to be put through an IV. And the patient must wait at the facility for a period of time to allow that to absorb sufficiently. The gamma camera detects radiation given off by a bone abnormality, and it shows up as a hot spot on the nuclear imaging. So you can see figure 14.14 on page 526 shows a scan of the feet, and you can see a little hot spot there, which indicates a stress fracture. Next, we have nuclear cardiac stress test. This is a diagnostic procedure used to evaluate the cardiovascular health of individuals with known heart disease or individuals at risk for developing heart disease, particularly coronary artery disease. It is more time consuming and expensive, but it does provide more accuracy, so it's a little better than a bone scan. A radiopharmaceutical is used and administered intravenously, and it targets the heart. It's taken in two phases, resting and stress phase. Resting is performed at a normal heart rate, and a stress phase is performed immediately after the patient exercises at his or her maximal heart rate to see what stress the heart's going through. Lastly, we have a PET scan. This stands for positron emission tomography, and this is a special type of nuclear imaging procedure that uses a special camera and computer to construct a 3D image of the area that's being scanned. This procedure is particularly useful in diagnosing conditions of the brain and heart, like brain cancer and heart disease. On your competency sheets, I believe there are 2 things that go along with this chapter, but you don't have specific procedures that are in the back of this chapter to review through. So some of the things that I'm going to leave for you all to do within class, you'll get a bag that has a couple of things inside of it. It's going to have a wooden spatula, a little white folded up piece of paper, and then also you're going to have a little, what would you call it? Like a little testing strip type thing, and it's going to be green. So this is going to be for your fecal occult blood stool test that goes along with chapter 13. So I'm going to leave that. But chapter 14 doesn't specifically have any. There are going to be some of your comp sheets, but it's essentially just reviewing the chapter, what we're talking about. So there's none for this one. There are the GFOBT for chapter 13, and I'll leave that with instructions for the sub to review with you all. And you're going to turn that back in next Tuesday, so you have a whole week to get it back to me. And I'll go ahead and tell you for that specific one, you do have to get a stool sample. It can be yours, it can be your kids, it can be your spouse's. If you have a dog or a cat, you can also collect it from there. But you only have to get one sample. So you're going to put it back inside of that biohazard bag. You're going to bring it in, and then you're going to put it in the back lab room on one of the countertops underneath the cabinets. So just lay it on the black part of the cabinet. And when we come back on Tuesday of the following week, when I'm here, I'll teach you guys how to use the little drops to interpret it and things like that. So if you have any questions, feel free to reach out and let me know. Don't struggle trying to go through this, but make sure that you're doing your homework. Make sure you're doing your review sheets because it can really help you with these things.